Did you know that by 2030, nearly 600 million people worldwide are expected to suffer from osteoarthritis? That's nearly 1 in every 13 people on the planet, an alarming rise fueled by aging populations, sedentary lifestyles, and increasing obesity rates. In the United States alone, over 60 million adults now live with some form of arthritis, making it one of the most widespread chronic conditions in the country. But here's the twist: osteoarthritis doesn't just affect the elderly. More and more people in their 40s and even late 30s are being diagnosed, often due to joint injuries, repetitive strain, or poor postural habits. And while the disease creeps in quietly, its impact is anything but silent. Pain, swelling, stiffness, and eventual loss of mobility can turn simple everyday activities into exhausting tasks. So how can you tell if osteoarthritis is already knocking on your door? What treatments actually work, and is it really possible to prevent it before it starts? In this video, we'll explore everything you need to know, from subtle early warning signs to evidence-based treatments, and finally, 7 powerful habits that can help you protect your joints for life. Stick around, because what you learn today could make all the difference tomorrow. Symptoms of osteoarthritis. 1. Joint locking sensation. Have you ever bent your knee or tried to stretch your fingers, only to feel them freeze in place like they're jammed shut? That terrifying locked sensation isn't just in your head, it's a classic warning sign of osteoarthritis. When cartilage in your joint starts to break down, tiny fragments can break loose and drift inside the joint space. These floating particles act like grit in machinery, jamming movement and triggering sudden stiffness or locking. It often strikes in the knees, shoulders, or fingers, turning a simple motion into a frustrating standstill. In some cases, it may feel like the joint is completely stuck, leaving you unable to bend or straighten it without assistance. This can be more than just annoying, it may signal structural damage that needs medical attention. If your joints ever freeze unexpectedly or make clicking sounds followed by sharp discomfort, don't ignore it. Consulting a healthcare professional could be the key to unlocking your joints' mobility before the damage worsens. 2. Joint deformity. Imagine looking down at your hands or knees one day and realizing they no longer look or move the way they used to. That's the harsh reality of joint deformity caused by advanced osteoarthritis, a stage where pain becomes constant and function starts to fade. As the protective cartilage erodes, bones begin grinding directly against each other. This abnormal friction causes the joint to change shape, forming hard bony lumps and unnatural angles that make everyday movements difficult or even impossible. You'll most often see this in the fingers, knees, and feet, where joints become swollen, twisted, or visibly enlarged. It's not just a cosmetic issue, it's a painful, mobility-stealing transformation. While early intervention with targeted exercises and anti-inflammatory medications can slow progression, in severe cases, joint replacement surgery may be the only way to restore function. Don't ignore the warning signs. What begins as stiffness could end in permanent deformity without timely care. 3. Night pain. Many people with osteoarthritis find their days manageable, but it's the nights that are the hardest. One of the common issues for people with osteoarthritis is night pain, which can interfere with sleep. This pain is usually caused by joint inflammation and bone friction due to cartilage deterioration. During the day, joint movement helps produce synovial fluid, which lubricates the joints, but at night, reduced movement can lead to increased stiffness and pain. Additionally, sleeping in improper positions may put extra pressure on the joints, worsening the discomfort. To alleviate night pain, using supportive pillows, maintaining a comfortable room temperature, and performing gentle stretches before bed can be beneficial. 4. Joint popping or grinding sound. Ever heard a snap, crackle, or pop from your knees or fingers? That sound may be telling you something more serious. A common symptom of osteoarthritis is a popping or grinding sound in the joint, known as crepitus. This occurs due to the breakdown of joint cartilage, which increases friction between bones. Normally, healthy cartilage ensures smooth and silent joint movement, but as osteoarthritis progresses, the joint surfaces become rough, leading to these unusual sounds. Crepitus is most commonly observed in the knees, neck, and fingers. If the popping sound is accompanied by pain, it may indicate significant joint damage. To manage this condition, engaging in gentle exercises, taking joint-supporting supplements, and reducing strain on the affected joint can be helpful. 5. Joint warmth and redness. A warm and reddish joint may be more than just a passing irritation, it can be a warning sign. One of the less commonly discussed symptoms is joint warmth and redness. This symptom occurs due to inflammation within the joint and is typically observed in the later stages of the disease. As the cartilage in the joint wears down and bones start rubbing against each other, the body triggers an inflammatory response, increasing blood flow to the affected area. This increased blood circulation can make the joint feel warm and cause the skin around it to appear red. Although this symptom is not as severe in osteoarthritis as in inflammatory conditions like rheumatoid arthritis, it can still lead to discomfort and increased joint sensitivity in some individuals. 1. Joint pain. At the heart of osteoarthritis lies the one symptom most people fear: joint pain. It is one of the most common and earliest symptoms of osteoarthritis. This pain usually worsens when moving the joint or after physical activity. In the early stages of the disease, the pain may be mild and occur only in specific situations, such as after exercise or prolonged use of the joint. As osteoarthritis progresses, the pain becomes more persistent and may even be present at rest. This pain occurs due to the gradual breakdown of joint cartilage, leading to increased friction between bones. To reduce pain, methods such as light exercise, applying hot or cold compresses, and taking anti-inflammatory medications as prescribed by a doctor can be helpful. Understanding the symptoms of osteoarthritis is the first step toward recognizing and managing the condition proactively. From persistent aches to visible joint deformities, each sign reflects the severity and progression of the disease. However, early detection alone isn't enough. The more crucial step is applying the right treatments to slow down joint degeneration and enhance quality of life. Below are 5 effective treatment approaches widely used to manage pain, reduce inflammation, and improve mobility in osteoarthritis patients. 2. Weight loss and osteoarthritis treatment. Every extra pound you carry adds nearly 4 pounds of pressure on your knees. Imagine what that means if you're even just 10 or 15 pounds overweight. Your joints are under relentless stress every step you take. For people living with osteoarthritis, especially in weight-bearing joints like the knees and hips, this added strain fuels inflammation, sharpens pain, and accelerates joint damage. But here's the good news: even a modest drop in weight, just 5% to 10%, can significantly reduce joint pain and improve mobility. Losing weight also helps build stronger muscles around your joints, giving them more support and protection against further deterioration. To see lasting results, combine smart nutrition with low-impact activities like walking, swimming, or cycling. It's not about perfection, it's about momentum. Each pound lost is one step closer to less pain, smoother movement, and a better quality of life. So start small, stay consistent, and let your joints feel the difference. 3. Pain relievers and osteoarthritis treatment. Pain relievers are a common method for managing osteoarthritis symptoms. These medications can help reduce joint pain and improve the quality of life for individuals with osteoarthritis. One of the most commonly used pain relievers is acetaminophen, which is effective for mild to moderate pain. It is typically used for temporary and short-term pain and has fewer side effects compared to non-steroidal anti-inflammatory drugs. On the other hand, NSAIDs like ibuprofen and naproxen are more effective for more severe pain and joint inflammation. These medications work by reducing inflammation, which in turn alleviates pain. NSAIDs are usually taken orally or applied topically. In cases of chronic and intense pain, a doctor may prescribe stronger painkillers or opioid medications. In addition to pain relievers, joint supplements such as glucosamine and chondroitin can also help reduce pain and support joint cartilage. 4. Light exercise and osteoarthritis treatment. Light exercise is one of the best methods for managing osteoarthritis. Engaging in regular physical activities can help reduce pain and improve the range of motion of the joints. Activities like walking, swimming, cycling, and yoga can strengthen the muscles around the affected joint and reduce the pressure placed on it. By doing these exercises, muscles gain strength, providing better support for the joint. Additionally, light exercises can help maintain joint flexibility and prevent stiffness. For individuals with osteoarthritis, performing exercises in water can be particularly beneficial, as the water reduces body weight and puts less strain on the joints. Exercise not only helps reduce pain but also brings a general sense of well-being and improves the quality of life. However, it's important that the exercises are done correctly and under the supervision of a physical therapy specialist to avoid further injury. 5. Physical therapy and osteoarthritis treatment. Physical therapy is one of the main and effective treatments for managing osteoarthritis. The primary goal of physical therapy in osteoarthritis is to improve joint mobility, reduce pain, and strengthen the muscles surrounding the affected joint. Physical therapy treatments include a variety of strengthening exercises, stretching techniques, and manual therapy to increase the joint's range of motion and reduce stiffness. This method is especially beneficial for joints like the knees, shoulders, and lower back. Physical therapists can design specific exercises to improve muscle strength and joint flexibility. These exercises not only help reduce the pressure on the joint but also prevent further progression of the disease. In addition to exercises, physical therapy treatments may include manual techniques to improve joint alignment, local heat or cold therapy, and electrical treatments. Physical therapy can generally help manage osteoarthritis effectively when combined with other treatment options, such as medications and supplements. 6. Using hot or cold compresses for osteoarthritis treatment. One effective method for reducing pain and inflammation in osteoarthritis is using hot or cold compresses. This simple and accessible technique is widely recommended for alleviating osteoarthritis symptoms. Cold compresses are typically used to reduce inflammation and swelling in the joints, especially when the joint has become inflamed due to excessive movement or injury. Applying an ice pack or cold compress to the affected area can help reduce blood flow and limit inflammation. On the other hand, hot compresses are beneficial for easing chronic pain and joint stiffness. Heat increases blood flow to the joint and relaxes surrounding muscles and tissues, which can relieve pain and improve joint flexibility. These methods can generally be effective alongside other treatments like medications and physical therapy. It is recommended to use these treatments for short periods and at specific intervals to avoid any potential harm or overstimulation. While treatment options can help control symptoms and maintain joint function, preventing osteoarthritis from occurring in the first place is the most effective solution. Prevention not only protects the joints but also reduces the need for future interventions and supports long-term wellness. With the following 7 simple yet powerful strategies, you can take control of your joint health and significantly lower the risk of developing osteoarthritis in the years ahead. 1. Avoiding prolonged sitting to prevent osteoarthritis. You may not realize it, but sitting for hours at a time could be slowly damaging your joints. In fact, research shows that prolonged sitting increases the pressure inside your knees and hips, accelerating joint stiffness, inflammation, and the onset of osteoarthritis. The solution? Don't stay still. Set a timer and stand up every 30 minutes. Even brief movements like stretching, twisting your spine, or taking a quick walk around your home or office can dramatically relieve joint stress. And if your job demands long hours at a desk, make sure you're using an ergonomic chair and shifting positions regularly. These small adjustments may seem minor, but they're powerful tools to help you maintain healthy joints and prevent long-term damage. Don't wait until pain becomes your reminder. Start moving now to protect your future mobility. 2. Maintaining a healthy diet to prevent osteoarthritis. Maintaining a healthy diet plays a significant role in preventing osteoarthritis. A nutrient-rich diet helps maintain joint and bone health and can prevent joint inflammation. Foods rich in omega-3 fatty acids such as fatty fish, and anti-inflammatory foods like leafy greens, berries, and nuts can help reduce inflammation. Additionally, vitamin D and calcium are essential for bone health. Consuming calcium-rich foods like dairy products and leafy greens, as well as vitamin D sources like sunlight and fish, can help prevent osteoporosis and joint problems. Furthermore, it is important to avoid processed foods high in trans fats and sugar, as these can increase inflammation and worsen joint damage. 3. Wearing proper footwear to prevent osteoarthritis. What if the very shoes you wear every day are silently setting you up for joint pain in the future? Shoes that lack proper arch support or have thin, rigid soles may look stylish, but they force your knees, hips, and lower back to absorb more shock with every step. Over time, this extra pressure can inflame your joints and accelerate cartilage breakdown, leading directly to osteoarthritis. But it doesn't have to be this way. Choosing shoes with soft cushioning, strong arch support, and a sensible heel height can drastically reduce the impact on your joints. Think of your footwear as a daily investment in your joint health. Whether you're walking around the block or standing at work for hours, every step counts. So make it a habit. Before you walk out the door, ask yourself, are my shoes supporting me or sabotaging me? 4. Avoiding sports injuries to prevent osteoarthritis. Avoiding sports injuries is one of the key ways to prevent osteoarthritis. Repeated joint injuries, especially in high-impact sports or when proper protective equipment is not used, can increase the risk of developing osteoarthritis later in life. Using appropriate gear like knee pads, elbow braces, or helmets during physical activities can help prevent joint injuries. Additionally, warming up and stretching before exercise, along with employing proper movement techniques during workouts, can reduce the strain on joints and prevent injuries from improper movements. Preventing sports injuries, especially at a young age, can protect the joints and prevent the onset of osteoarthritis in later years. 5. Strengthening muscles around joints to prevent osteoarthritis. One effective method to prevent osteoarthritis is by strengthening the muscles around the joints. Strong muscles provide support to the joints and reduce the pressure placed on them. By strengthening muscles, joints are less exposed to injury and will function better. Exercises to strengthen the muscles of the thighs, lower back, and shoulders in particular can protect the joints in these areas. Muscle strengthening not only helps prevent osteoarthritis but also improves joint mobility and flexibility. These exercises are especially important for individuals at higher risk of joint injuries. Regular strength training can help maintain joint health and prevent the progression of osteoarthritis. 6. Regular exercise to prevent osteoarthritis. Regular exercise is one of the best ways to prevent osteoarthritis. Physical activity helps strengthen the muscles around the joints, reducing the pressure placed on them. Exercises like walking, swimming, and cycling are beneficial not only for strengthening muscles but also for maintaining joint flexibility. Regular workouts improve joint movement and prevent stiffness and pain. Exercise increases blood circulation and reduces inflammation in the body, which helps maintain overall joint health. In general, regular physical activities can prevent osteoarthritis from developing in later years and improve quality of life. 7. Maintaining a healthy weight to prevent osteoarthritis. One of the best ways to prevent osteoarthritis is by maintaining a healthy weight. Excess weight puts significant pressure on the joints, especially weight-bearing joints like the knees, increasing the risk of developing osteoarthritis. When body weight is controlled, the pressure on the joints decreases, which helps reduce pain and inflammation. Even a modest amount of weight loss can have a positive impact on joint health. In addition, maintaining a healthy weight contributes to overall body function and increased energy levels. To achieve this, incorporating a balanced diet and regular physical activities such as walking or swimming into daily routines is recommended. Osteoarthritis may be one of the most common joint conditions worldwide, but that doesn't mean you're powerless against it. As we've seen, recognizing the early symptoms, from joint pain and stiffness to locking sensations and deformity, is the key to timely intervention. With proven treatment options like hot and cold compresses, physical therapy, exercise, weight management, and pain relievers, it's absolutely possible to manage the disease and maintain a good quality of life. And most importantly, prevention remains your greatest weapon. Through daily movement, a healthy diet, proper posture, and the right footwear, you can protect your joints well into old age. If you found this video helpful, make sure to like, share, and subscribe to our channel. We're here to guide you with practical, science-based tips to keep your body strong and pain-free. Take charge of your joint health. Your future self will thank you.